Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
So I talk a lot about spinal ligament injuries are the number one cause of chronic pain and disability in the world today because they are. Spinal instability is the number one cause. It's the number one cause of lumbar problems, cervical problems, it's the number one cause of headaches. But let's just talk about some general suggestions that you can do to improve your injury results with these patients. Right? So one of the things with a patient is you want the patient to understand that injury recovery is not to be taken lightly. These injuries are the most primary common cause of chronic pain. Patients that have ligament injuries have a 50% chance of never fully recovering. 30% of those patients are going to have a significant problem long term. These ligament injuries are the leading cause of long-term residual complaints. So you want to really impress upon the patient how serious they are and the fact that during their recovery time, there's some general things that they could do and that you need their help, that their compliance with your treatment program, their active participation in their own recovery is the key to optimal results. You need to get them to understand that you are not treating an insurance company. You're not treating their attorney. You're not treating anyone. You're treating them. And everything you do is geared to assist them with optimal recovery. You need to let them know that you use state-of-the-art imaging procedures in order to assess these injuries. That's how significant they are. You can tell them that you use, the top board-certified medical radiologists in the world to locate and identify these injuries, to assist you with what are called excessive motion tests. You need to let them know that this treatment plan that they're going to have is going to be individual to them and to their needs. And that if they need to change appointments, but it's very important to comply with the schedule, not because you're trying to be enriched, but because you're actually trying to help them. You need to let them know that if they need to change appointments, they have to keep the continuity of their own care. So in other words, if you got them Monday, Wednesday, and Friday, and they need to miss a Wednesday, fine, they put it in on Tuesday or they fit it on Thursday, they get the 3 visits in a week. They get the 2 visits in a week. So if you've got them under dose scheduled care, the dosing of the scheduled care is very important, and they need to know that. They need to know that if something on the plan is not consistent with producing results for them. So if they have some discomfort in their recovery, if you've given them some sort of an exercise program, you've given them something to do either in the clinic or outside of the clinic, and it causes pain, you need to communicate with them that they need to know, they need to let you know right away. You need to let them know that they may have need for supportive care. So when our doctors actually assess a patient, they're talking about the need. When patients have ligament conditions, ligament injuries, they can need ongoing supportive chiropractic spinal care on a regular basis. Regular basis might be twice a year, might be once a year, might be 5 times a year, might be 6 times a year. But patients do better long term with spinal hygiene, with maintaining a spine. And it can be called supportive care when it also maintains the ability to keep the symptom away. So now, what I want to talk about, though, today is let's talk about some general things that you can do. Body hydration is a key component, and it's one of the key things that is out with a lot of patients, and it really, really does help in the wound healing stages. Proper hydration is essential in the wound healing stage. The lack of body hydration will halt cellular migration, decrease oxygenation of the blood, and vastly delay the wound treatment process, and the majority of patients in the market today are dehydrated. So you need to get them to drink more water. Now that sounds really, really simple, but there's so few doctors that do it, right? Because they don't. In the Smart Injury Doctors program, we have a thing called the Smart Injury recommendations. And in those recommendations, we recommend basic things to the patient. And one of them is you got to properly hydrate. So typically, the body fluctuates from 60 to 70% of the total weight is water. Now, to maintain that positive level of hydration, you need to have no less than 64 ounces of water be consumed on a daily basis. So the recommendation is half your body weight in ounces a day. Now, if a person weighs 300 pounds, that's 150 ounces. If they weigh 400 pounds, it's 200 ounces. If they weigh 100 pounds, it's 50 ounces. So you got to get them to, you have to get them to hydrate and be hydrated. The other thing you got to do is get them to have proper sleep in injury recovery. Right? So, when patients have a spinal instability, they could have neck pain, lower back pain, shoulder pain, scapular pain, pain radiating down their arms, pain radiating down their legs, numbness, tingling, sense of weakness or heaviness in the legs, numbness or tingling or sense of weakness or heaviness in the arms, headaches, migraine headaches, facial pain, ear pain, visual disturbances, ringing in the ear, difficulty swallowing, difficulty breathing, bladder or bowel dysfunction, sexual dysfunction, severe fatigue, loss of voice, disturbances in concentration, disturbance in memory. These are common symptoms. Some are more common than others that they could have that cause them, especially when we're talking about pain, that could cause them to start to reduce their ability to sleep. But your body needs to sleep because that's when it repairs. So you've got to work with them to make sure that they are getting good sleep. When your body's tired, also, it's usually seeking ways to create more energy. This can lead to cravings for sugary, fatty foods, things that are not good for your body, things that are not good for your sleep cycle. So you got to get them to work on sleep. So when we look at an adult today, it's recommended by the Mayo Clinic that optimal sleep for an adult is 7 to 9 hours a night. If you got a 14 to 17-year-old, it's 8 to 10 hours. If you got a 6 to 13-year-old, it's 9 to 11. 3 to 5 is 10 to 13. 2 years, it's about 11 to 12 hours a night plus 1 to 2 hour afternoon nap. 12 months, about 10 hours at night plus 4 hours of naps. Newborns, 14 to 17 hours a day. So you can see as the body is growing, it needs more sleep. When the body is in repair, it needs more sleep. And these things can be addressed. Now, the patient should know that there are 3 stages of correction in the body. Phase 1 is called the inflammatory phase. That's phase, first 4 days. That's when the injury is painful. There's a lot of heat. There's swelling. It draws the healing chemicals to the area. Then from day 4 to 21, we call this phase 2. It's called the proliferation phase. And that's where the damaged tissue is gotten rid of. A new temporary tissue is being built, and new blood supply lines are also being formed. And then we have from 21 days to 2 years, a remodeling phase, where permanent tissue is being built, replacing the temporary tissue. All tissue is then remodeled for optimal function. This is what's occurring. So that's why hydration and sleep are important. Other things you can do is make sure the patient is on or knows at least about an anti-inflammatory diet. Inflammation can cause injuries to actually be retarded in the repair process, and it can cause ongoing chronicity. So what should they eat? Well, they should eat more anti-inflammatory fats. These are things like fish oil, flaxseed oil, avocados, fish, mackerel, salmon, sardines, olive oil, mixed nuts, seeds. They should eat fewer pro-inflammatory things like processed foods, high in saturated fat, vegetable oils like corn oil, sunflower oil, safflower oil, soybean oil. Foods with trans fats, those are fried foods, right? So what can they do? Well, they can eat more pineapple. It has a lot of bromelain in it. They can eat more garlic. They can eat more curcumin or turmeric or curry powder, more cocoa, teas and berries. These are things that are in the anti-inflammatory area. Any of your vegetables are anti-inflammatory, right? So they have to eat adequate protein. So a balanced diet would be 1/3 fat intake from saturated fat, 1/3 from monosaturated, and 1/3 from polyunsaturated fat. So the bottom line is you want good fats, you want great vegetables, and you want things that are anti-inflammatory, and there's herbs that you can take in order to do that. Garlic's one of them, curcumin's one of them, turmeric, curry, cocoa. So you want to have them in basic recommendations. You want to give these patients these as things that will help and assist in their long-term recovery. Because remember, when you're treating that patient, you're treating that patient's future. You want that patient's future to be good. So there's 3 general things. Hydration is excellent. Sleep and anti-inflammatory diet. These are 3 things that you can add to whatever else you're doing in your clinic that will significantly improve your results and make your patients healthier. And as a result of that, they'll get better results. You'll have better referrals. You'll have a better reputation. And these are things that are very, very easy to put into a clinic. Again, in the Smart Injury Doctors program, we have a form called the Smart Injury Recommendations that go over these 3 basic recommendations so that patients can actually experience better recoveries. Doctors, this is a very short program, like all programs, short, sweet, and to the point. I hope you enjoyed it. I hope it helps. Definitely get your hydration. Definitely get your anti-inflammatory diet, and definitely get the patient to sleep better. Doctors, if you have comments about today's program, please put them down below. Or if you have comments about what you're struggling with in private practice today, put them down below. This is what I'll use for content for future topics. Doctors, thank you very much for giving me your attention today. I hope in some way this has helped you and to help your patients to get better results. Thank you very much, and I'll see you on the next program.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.